This video we're going to talk about treatment using a dowel rod for the SC joint. So I have her pre-positioned in this diagonal and we're focused on the left SC joint, okay? So in this diagonal, if I am going to assess the mobility, I actually need to be standing in the perpendicular diagonal to that, all right? So if I am taking her into extension abduction, then I am doing a pull technique towards me because the clavicle needs to move superior and decompress, okay? So as I'm taking her into that position, I'm feeling for an infeel, and it really feels pretty springy. Like it feels like it goes and it moves, and then if I spring test with my fingers, it's springy, so I'm not interested in that as much. Now I'm just gonna come to the opposite surface of that clavicle, of that SC joint. So now I'm superolateral going inferomedial, because as her arm comes up and across, the clavicle needs to go inferiorly and compress. Okay, and I'm going to change my hand placement here. So as that goes to move right there, there's a hard infill there. And if I spring test it, it is hard and it probably doesn't feel great. Okay, so then let's just say I want to go ahead and mobilize that because I'm very interested in it. Ideally, I would check all 4 diagonals before I start to treat. So now I'm here and I can hold here. Don't let me move you, Kelsey. So she is trying to go in an extension abduction pattern, and I'm blocking her clavicle inferiorly and compressing against the manubrium, and let it go. Good. And now I can just feel, can I take her any further into that diagonal? And then hold there. Don't let me move you. So I am blocking again inferomedially, and let it go. And I just want to approach the infield each time, okay? So I don't want to blow through that infield, I just want to approach it. Same thing all throughout functional manual therapy. Now, if we go on this diagonal and arm straight up, now she's going to be working here, okay? In this diagonal, I am perpendicular to that diagonal. So if we start with having her go into extension adduction, okay? The clavicle needs to move superiorly and compress, okay? So I'm doing a push technique starting on the inferolateral portion of the clavicle, or of the medial clavicle, moving into extension adduction. So I am blocking superomedial, and I'm feeling how does that compress, and it actually feels pretty good, okay? So springy infill there. Now if I go to the opposite side of that joint, or opposite side of the clavicle, I'm on the superomedial surface of the clavicle, pulling inferolateral. I'm taking her, I'm not on the barrier right now, I'm taking the arm up to where it wants to start moving. There, spring test, a little bit of a hard infill, but not as hard as coming up and across. So now that I'm here, I can block and then don't let me move you. And I'm just trying to take her further into flexion abduction pattern. So she is turning on her extensors and adductors to resist this, and it's engaging that infill, and let it go. And I would see, can I take her a little further into that range? Yes, I can. Continue to try and chase that hard infill as I wind her up. That actually just released it a ton. Right there's the next one. And then hold here, don't let me move you. So again, I'm just getting up to where I first start feeling that infield come into my finger, or hardness come there, and let it go. Okay, so that would be assessing and treating using the diagonal approach with a dowel rod of the SC joint.